Okay, so I'm doing version 4 of the recording. Can my patient please come in?
Hello, doctor. Good morning.
Hello. Good morning. How are you doing?
Um, I'm doing. I'm not so good, but yes.
Okay. I heard, I saw that you were filling out your form before and that you have hip pain. Is that correct?
Yes.
Okay. You are also 45 years old.
Yes.
You don't need your laptop, by the way? Okay. Can you please tell me why you are here with me? I will take a few notes.
Okay. I'm having pain on my left hip. That starts some weeks ago when I was lifting my groceries.
Okay.
And since then, I start to have like a nagging pain, and after some days started to be stabbing and a sharp pain.
Oh.
So that it's being annoying for me.
Okay. Okay. Can you also tell me how painful it is? Maybe from a 1 to 10 scale, like how painful is it for you?
Maybe on 6.
A 6. Okay. Okay. Do you have like a diagnosis from the GP perhaps?
No, he only say to me come to the physiotherapist because it's not his specialization. So I would try maybe come to you and try to find maybe hypothesis about my diagnosis, and if it's necessary go to other specialists such as orthopedist or something like that.
Okay, but you haven't been there.
I was there to be indicated, but she knows about my pain, but she don't know what's happening because her specialization is in other areas. So she knows I have a problem, but she don't know what to do with that.
Okay, okay. Thank you. Okay, and do you know when it started, or was it like a sudden start, or was it a gradual start?
It starts like 3 weeks ago, like I said, and suddenly and gradually starts to worse.
Gradually, okay.
Like I have an event like on the lifting my groceries when it starts, and after that gradually start to be worse.
Okay. Do you experience some stiffness perhaps in your hips?
Yes.
Okay.
Every day.
Really? Okay. When exactly? Do you have it in the morning or during the day?
Yeah, it's in the morning, almost 30 minutes.
30 minutes. Okay. Okay. What sort of activities you are doing? What is the most limiting factor for you?
So I have 2 situations is bothering me more. It's about my job. I am a nurse, so when I need to help my patients, I have a lot of pain.
Yeah, I can understand.
Also, when I do yoga weekly, and I'm not being able to go to the sessions because of the pain. Of course, I do a lot of movements on my yoga, and that starts like a relaxation moment for me, and now it's a stressful moment because of my pain.
Okay.
So yeah.
Okay, so you're working as a nurse. What kind of movements do you do there which causes the pain? Is it only like lifting, what you mentioned that you lift in groceries? Do you have to lift heavy?
Exactly. I lift my patients.
Oh.
So that's sorry. So that's a problem for me. Also, I need to stand up all day, and yeah, which more I do the movements, more I have pain.
Okay.
So the hours for me, the factor hour more lifting, it's something heavy.
Okay. Can you tell me about that yoga which you miss now? When you're doing your yoga, is it more active yoga or is it more like relaxing? Are you doing lots of self-weight movements, for example?
So it's a group, yoga group.
Mhm.
We follow the teacher. It depends of the class. So sometimes it's about relaxation, sometimes it's about mobility, flexibility,
Okay.
and I cannot do any more the movements. I have a little bit. I don't know how to explain to you. Sorry, doctor, but sometimes I don't complete the exercise. Like I am not able to complete all my movement
Okay.
with my legs.
So you feel that you cannot reach, so you have a bit of muscle limitation, you think?
I don't know if it's muscle, but yeah, I have limitation,
Okay.
so I cannot complete all my activities.
Is your range of motion also shorter, do you think?
Yes.
Okay, that's good to know for me. Okay, let me just tell you back what I understood, so that everything is clear. If I did something wrong, please let me know. So you said that you are a nurse and you're lifting also people and you want to do also yoga weekly. You have difficulties in your left hip, and which is also manifesting in lifting groceries. You have stiffness in the morning, which is approximately 30 minutes. It started 3 weeks ago, and it becomes increasingly worse. You haven't been to a GP, or you have been to a GP, but there was nothing said before, which I need to specifically prepare myself for. So also the GP did not say that you cannot come to the physiotherapist, so that's good. You have a pain approximately a 6, so that it's painful in a rating of 6. Okay. So I was just asking these questions for me to know what sort of activities I should prepare for you. I would like to do physical examination, but I'm going to walk through what sort of physical examinations I would like to do with you. So one, I would like to see an activity daily life. So I want to see what kind of exercises you have the most issues with.
Okay.
So I can see your range of motions and where the pain starts. Afterwards, I would like to also palpate your hip to see whether it's swollen, if it's maybe red, or where exactly it starts to have like pain. I want to also check whether if it's like a difference in muscle as well. And for that, I want to see a passive test for you. So we can see how limited your range of motion is, perhaps. So maybe there is a difference between your left hip and your right hip. I want to do also endo rotations, so just to filter out whether it's more joint issue or whether if it's a muscle issue for you. An active test where I want to see where your motion is and what you can do with your muscles, and a quick strength test for the muscles which are involved in this. And the last one is a muscle length test to see whether if it's shorter. One of the muscle is shorter than the other.
Okay, doctor. Thank you very much. Just one thing. Do you think maybe in 3 weeks I can go back to yoga? Because that is so important to me. It's not only an exercise. As I said to you, it's like my relaxation, and I have my friends there. So
yes, I understand. I think the most important is that we see what is the main issue, but I think you should be able to go back to yoga, especially if it's also a strengthening training. so that you can keep your strength. That's very important, especially after 40 years old. We tend to lose our muscle a bit, so that we can work on not losing your muscle mass, and you can actively do not only yoga but also, very importantly, your job.
Okay, and I have some measures for to my job right now because I cannot stop going, but that it's hurting me. So you have some advice for me during this time, or do you do that after the examination?
I will do that after the examination.
Okay.
Yeah, I will do that after the examination.
Thank you
So
very
we'll
much,
exercise.
doctor.
Thank you.
Thank you.
Okay, we are here as an observer. As an introduction, you did very well in sufficiency. I like that your type of question.
Yeah.
You did and you used open-ended question, and everything was great. And I think the conclusion was too much for patient. I mean, it doesn't really necessary to deep or explain every detail. So I think you just need to mention a bit what we're gonna do for the next session. And at the end of, in the conclusion, I think you use a bit professional explanation, like in the rotation and things. So patient, I think, don't know about those words and things.
Yeah,
What do you think?
I was about to add, I'd say from a physiotherapist perspective, it would be beyond advanced knowledge, and it's amazing and it's great. But from a patient side, if I was a patient and I heard this, I might feel a little, not confused, but unsure. So I'd try to limit it down to more daily life used words. But other than that, I think the explanation, the clinical reasoning, all of that was
Yeah, I agree.
very, very accurate. Yeah.
Yeah, as everyone said, I agree with them, and the therapist's reaction was also good. I mean, you made eye contact with the patient during the session, and you was listening actively. And about the some words that you've used, for example, endorotation and something like this, I think it was normal. It wasn't, from my view, it's not too deep because.
Because
We all go.
Yeah, you already know about
No,
that.
actually, we all go to the doctor, and sometimes doctor use some words, and after the next session, we will understand what the doctor should do with us, and it's normal. Maybe some patient know some words. Endorotation is not, for example, that. For example, if she use some name the muscle, for example, musculus iliopsoas, something like this, maybe this is made patient confused. But endorotation, it's not that deep.
I don't know what you want.
Yeah, I was just thinking from a perspective anatomy. Anatomy you can't change. You can't really do anything about it. With anatomy, if it's complicated, it's complicated.
Yeah.
But with this, you can say endorotation or external rotation, and maybe you can show it, demonstrate it.
Yeah, exactly.
Yeah, so
that's
this
how you
was
should.
clearly just about communication, because my weakness was communication.
Yeah, no.
Yeah.
So that's why I wanted to have
Of
like the
course,
communicational
focusing on
topic,
the-
so that it's this was my what I want to improve the most.
But from a point of communication, I think you're very open, very friendly, and I feel like she was very comfortable
Yeah,
to
exactly.
further elaborate, because especially when you would ask her a question, she wouldn't give one-worded responses, and the way you worded and structured your sentences and the way you answered or asked questions, I think it was
Totally,
very
everything
successful.
was
Okay.
really great.
Thank you.
Amazing. All right.
Okay, sister.
Yeah.
Okay. So I think that the observers did a really good job, and they covered it all. And I'm really. Okay.
Just continue.
Oh, okay.
We'll crop it out.
Again. Okay, so I think that the observers did a really good job, and I think they're right that the patient would lose their attention when you're explaining more professionally. So that's the thing.
Finish? Well, firstly, I think the whole person went through good, and believe he's acted good. But the one point that the observer mentioned is that Bogi explained too much and Bogi spoke too much professional definition about something like that physiotherapy definition. But you didn't point that the patient was the nurse. So she was completely familiar with the medical explanation. So I think
That's actually
Bogi
very good.
went through very good about this
Yeah.
matter.
Eliminated.
And all of rest was good and okay. It was okay.
Thank you.
Amazing. Thank you very much.
I will use that in my